Chiari type 1 and Chiari type 2 are both hindbrain malformations, but they differ in which structures herniate, how severe they are, when they present, and what other findings tend to come with them. In Chiari type 1, the key finding is downward ectopia of the cerebellar tonsils below the foramen magnum. It's usually congenital, but many patients have no obvious symptoms during childhood. When symptoms do appear, they often show up later in adolescence or adulthood, commonly as headaches and signs of cerebellar dysfunction like imbalance or coordination problems. Chiari type 2 is more severe. The herniation involves not just the cerebellar tonsils, but also the vermes and the medulla passing through the foramen magnum. Because more structures are involved, Chiari type 2 usually presents much earlier in life, often in infancy or childhood rather than adulthood. A classic association with Chiari type 1 is syringomyelia, or spinal cord cavitation, which is an important clue when you're thinking through the diagnosis. Chiari type 2 is commonly linked to non-communicating hydrocephalus, often from aqueductal stenosis, and to lumbosacral myelomeningocele that may cause paralysis or sensory loss at and below the lesion. So the high-yield difference is this. Chiari type 1 usually means isolated tonsillar ectopia with later presentation, while Chiari type 2 involves broader hindbrain herniation, greater severity, and early life-associated anomalies. For personal medical advice, please talk with your doctor.